Hi, we are Julie, Jan, Marta, and Carla, and we are going to talk about eating disorders.
Good afternoon. I'm sure that everybody knows about what eating disorders are. This is the topic of our presentation. We are going to explain some of the most common kinds of eating disorders and give advice to those who suffer them.
Here we have the content that we will have to talk. First, we will have the definition of the eating disorder. Later, we have the graphs of all the types of eating disorders. Later, the types of eating disorders and the consequences. And the 2 points to final the presentation, we have the advice and the conclusion.
Eating disorder is an illness that causes serious disturbances to your everyday diet, such as eating extremely small amounts of food or several overeating. Okay, so here we have some graphs. The first one is about the comparison of some eating disorders between men and women. We can see that anorexia is more common in girls, that is the blue one, and less common in men, that is the green one. Bulimia is also more common in women than in men, but binge eating disorder is the same between men and women. And there is a graph that talks about the increase of the hospitalizations related with eating disorders from 1999 to 2006, and we can see that it's very alarming that among children under 12 years old, it has increased at 199%. This other graph is about children. Children are afraid of being fat, and this is very alarming because in the future they can bring it to have anorexia or bulimia. And 42% of all first through third grade children are afraid I want to be thinner. And if at this age you want to be thinner, it's not good because you should not have to think about these topics at this age. And here there's a comparison between an American woman and a supermodel. And when women see these other persons in magazines, they want to be like them, but it's not possible because their body is not prepared to have this.
Types and consequences. Anorexia. These are the 4 types of eating disorders more common in our society, and this is anorexia. Okay, anorexia is an eating disorder. People with anorexia think that they are fat, but they are very skinny. They try to lose weight and don't eat enough. And the consequences of being anorexic is that you can have a heart attack, the reduction of bone density, the muscle loss spread, and then the hair dries, and that's
all. Bulimia is a disease and it's an eating disorder where people want to eat a lot, but they don't want to be fat. So they eat a lot and then vomit, make themselves vomit to be the same weight. Some consequences of bulimia are bad teeth because of the gastric acids. There are irregular heartbeats that can bring you to a heart failure and death, and inflammation of the esophagus and possible break.
Here we have binge eating. Binge eating is a disease characterized of episodes of compulsive overeating. The characteristics are that people eat too much This is known by overeating. When this happens, they often lose control and cannot stop. Very often, they eat more food than other people in the same time. People feel very painful and distraught when they hear of eating. People want to make up the consequence of binge eating by some inappropriate, unhealthy ways. Consequences of binge eating are high blood pressure, high cholesterol levels, heart disease as a result of elevated triglyceride levels, type 2 diabetes, and gallbladder disease.
I'm going to explain the obesity. Obesity is when the people eat like fat food and sweets and McDonald's and these brands that it's not healthy for our body. We can have this type of body, and we have the consequences that are coronary heart disease, the high blood pressure, the strokes, the 2 types of diabetes, the some cases, the experiencing fertility problems, and no alcoholic fatty liver disease. These are the consequences of how to have obesity, and it's we think that is it's not healthy to have this because you don't see well with your body.
There is people that die because the obesity level of the body.
And here we have some reconforting sentences like if you are anorexic, here is. If you talk to your friends the way you talk to your body, you have no friends left. So that means that if you talk about
You put so much pressure on your friends as you put on your body, no one would like to talk to you because you talk very bad to them. Because there are some people that is very bad with her own body and this brings to have an eating disorder.
and there's another that I need to be skinner and fish no, so I need to love myself.
Very well. Quite interesting.
So here we have the advice that we want to say to all the people that have these concept,
Family member.
yeah. So the family member is advice, and we think that this family member has to be very with her family members that have this the obesity, anorexia, and to be more with they because they have to help.
And these consequences of have an eating disorder, if you have a family member with some eating disorder, you cannot pressure them because they can change their life. So you have to help them. They are attempts to deal with emotional and stress-related issues. You can force a person with an eating disorder to change, but you can offer you support and encourage treatment, and that can make a huge difference. So that means that you have to help a person and not to be always, you have to do this, no, you have to help them, and with the pass of the time, you will help them out.
Conclusion. Is our class healthy? Well, according to the survey done in our class, everybody eats vegetables and fruits every week and not a lot of junk or fast food. And everybody practices sport at least 2 times a week and has a balanced diet. So this means that anyone in this class is on risk of having an eating disorder.
Very well.
Well, I also wanted to tell, it's not in the PowerPoint, that yesterday when I was searching for some images for the poster, I found some web pages talking about anorexia, but not against anorexia. There were anorexian girls that were talking to other girls that anorexia was good. And for example, there was an image that said, you can eat junk food and be fat, or have all the clothes you want, have all the boy you want. And this is not good, and this has to end, because it makes that other girls that don't want to be anorexic, they make be anorexic because of these words, or
Wow.
make their situation worse.
Mhm. Okay, quite interesting. A big clap for them, please. Would you like to ask them anything? Okay. Paul.
I have a question about the situation. Imagine that you are a very popular boy in your classroom, and you discover that your little brother is overweight and the classmates of him makes him bully. What would you do?
First of all, talk to the teacher of my brother and stop all these bullying.
I have a question of a situation. Imagine that you are a very popular boy in your classroom, but you discover that your little brother is overweight and his classmates make him bully. What would you do?
First of all, if I was the brother, I talk to my mom or dad, and they have to talk to the teacher to stop this bullying of
Cut the situation
cut the situation.
as soon as possible. Mhm.
And if this don't works, talk to the boys or girls that that did the bully to my brother.
And it's important to talk to your brother and tell him that it doesn't care what others think. He doesn't have to do anything to his body that he doesn't want if he feels good with himself. But it's not good to being obese, and if this goes to a point that is bad for your health, he should try to be a little thinner.
Okay, thank you. Bernat.
What do you think about these sentences? Girls suffer more about anorexia than boys.
Well, we have shown this in the graph. There's a 90% of girls that suffer anorexia and just a 10% of boys. So the difference is very, very, very big.
And I think that this is true, that the girls suffer more anorexia than the boys, because the girls, the majority of girls like to be, the shape of her body like to be more better than the boys.
Well, and also the magazines show always thin bodies and perfect bodies, and it's not good
Mhm.
because
Okay.
it's impossible to go there.
Okay, thank you. Paula.
Okay, yesterday I saw on internet a webpage about bulimia, like do say of anorexia but in bulimia. What do you think about girls explain to other girls that bulimia is good and to be fat or to have a body shape that it's not very thin is good?
Well, these web pages should be cancelled or something.
Saturated.
Yes, because it makes people be anorexic, and it's very bad, because anorexia, we have shown that.
And if you
it's
have
very
a
bad.
friend that said this, you don't have to be with there because it's bad for yourself.
And this can make to some people that it is not bulimic, it can help to be bulimic some people that is not. So this must stop because it's not healthy for the people.
Okay, last question. Caral.
This is another situation. Imagine that you are anorexic but you don't know. How can you know that you are?
Well, I think that people should tell you, oh, you are so skinny or some things like this. But if you are skinny, this is not bad. But if you are very, very skinny and you don't want to eat, there are some symptoms that show you that you are anorexic.
Very well. A big clap for them. Thank you very much.